Hello everyone, my name is Sharanya Mantrala and I'm going to be talking about the effects of alcohol on diabetes and metabolic syndrome. Alcohol is one of the most widely used substances around the world. It acts as a depressant on the central nervous system, which is why it makes people feel relaxed. However, it also slows down brain function. This means that when someone drinks, their neurotransmitters or brain signals don't work as effectively. As a result, alcohol can cause poor judgment, reduced coordination, slurred speech, and slower reaction times. In the short term, heavy drinking can even be life-threatening, leading to blackouts, vomiting, or alcohol poisoning. In the long term, alcohol has major impacts on the body's organs, especially the liver and pancreas. The liver is where alcohol is broken down, but in the process, it produces toxic byproducts that damage liver cells and cause inflammation. Over time, this can lead to liver disease. The pancreas, which is responsible for producing digestive enzymes and controlling blood sugar, is also damaged by alcohol. Drinking can trigger pancreatitis, which is inflammation of the pancreas that can become chronic and very serious. Because the pancreas plays such an important role in blood sugar regulation, damage to this organ is linked to diabetes mellitus. Diabetes is a chronic condition where blood sugar levels stay too high. Type 1 diabetes happens when the immune system destroys insulin-producing cells in the pancreas. Type 2 diabetes, which is far more common, develops when the body's cells don't use insulin properly, often due to obesity or family history. Closely connected to diabetes is metabolic syndrome. This is not just one condition, but a group of health problems that occur together, like high blood pressure, excessive abdominal fat, high blood sugar, abnormal cholesterol, or triglyceride levels. A person is diagnosed with metabolic syndrome if they have at least 3 of these risk factors. The root cause is usually insulin resistance. When cells don't respond properly to insulin, the pancreas makes more of it, which disrupts blood sugar, increases fat storage, and raises blood pressure. Visceral fat, or fat stored deep around the organs, is especially harmful because it releases chemicals that cause inflammation and make insulin resistance worse. Finally, let's talk about the correlation between alcohol, diabetes, and metabolic syndrome. Alcohol doesn't directly cause diabetes, but drinking too much can increase the risk. Alcohol is high in calories, which can lead to weight gain and insulin resistance, both of which raise the chances of developing type 2 diabetes and metabolic syndrome. In people who already have diabetes, alcohol can also interfere with medications, sometimes causing blood sugar to rise. On the other hand, drinking too much can also lower blood sugar dangerously, since the liver prioritizes breaking down alcohol instead of releasing glucose. In conclusion, while alcohol might seem harmless in small amounts, excessive drinking can worsen the risks of both diabetes and metabolic syndrome. Moderation is key, especially for people with existing metabolic health concerns. Thank you.